Salt contains sodium, which we need, but too much can raise blood pressure and increase heart disease risk. About a third of healthy people and half of those with high blood pressure are more sensitive to salt, especially older adults and women. Menopause can make this sensitivity worse. So what should women know about salt and blood pressure? Hello, and welcome to House Calls. I'm Dr. Eduardo Sanchez, Chief Medical Officer for Prevention at the American Heart Association. High blood pressure increases the risk of stroke, heart disease, kidney disease, and other health problems. Too much sodium worsens it, and most Americans consume more than recommended. The American Heart Association suggests limiting sodium to 1,500 milligrams a day, especially for those with high blood pressure. As we age, and especially after menopause, salt sensitivity becomes more of a concern. Here to talk with us about high blood pressure and salt sensitivity in women is Dr. Jessica Faulkner, Assistant Professor of Physiology at the Medical College of Georgia at Augusta University. Dr. Faulkner, welcome to House Calls.
Thank you very much for having me. I'm very excited to be here.
Let's start by asking how salt or sodium affects blood pressure in some people, but not others, regardless of gender. What might be the difference between people who are salt sensitive and those who are not?
Absolutely. So there's a couple of different ways that salt can cause high blood pressure. It can actually cause damage to the blood vessels, which then leads to an increased risk for an increase in blood pressure when a person eats too much dietary salt. Other mechanisms, other ways that can happen is if the kidneys are damaged. The kidney is a filter that excretes salt and water and keeps that balance in the body. And if the kidneys are damaged and salt is not getting excreted in the right proportions, then we have an increase in pressure in response to that as well.
Tell us about the differences in high blood pressure rates in men versus women. Why might risk of hypertension and of salt sensitivity differ between the sexes, even in young to mid-adulthood?
That's a great question. And so blood pressure is very dynamic throughout our life. In young men and women are typically have a lower blood pressure than men do. This changes with the menopausal transition. So after menopause, they actually become at increased risk for that high blood pressure. So an 80-year-old woman is more likely to have high blood pressure than an 80-year-old man. However, a 25-year-old woman is less likely to have high blood pressure than a 25-year-old man. However, salt-sensitive hypertension actually has a higher prevalence in women, and that's in both young and older women that are in the postmenopausal phase. So salt-sensitive hypertension, and this is what researchers like me are trying to understand, for some reason it has a higher predisposition in women, and it is a higher risk in women of all ages.
In salt-sensitive people, what exactly is driving the high blood pressure? Is it a change in the blood vessels or changes elsewhere?
In response to a high dietary salt diet, blood vessels can get damaged, the kidneys can get damaged. There's other organs that can also get damaged, the heart and brain, and that's something that we're still trying to understand is how the increase in salt just coming from the food that we take in can actually lead to the damage in these organs that then leads to an increase in blood pressure in response to that salt that we eat.
Let's add pregnancy into the mix. How does that impact blood pressure and perhaps salt sensitivity for women?
This is actually one of the main focuses of my research, is trying to understand how high blood pressure in pregnancy develops. So high blood pressure of pregnancy is a growing problem in both the United States and worldwide. It's estimated that there's up to 10% of pregnancies now that are experiencing some form of hypertension or high blood pressure, which puts the mother at increased risk for adverse outcomes, as well as the baby at increased risk for adverse outcomes such as low birth weight or early term delivery. In addition, and really detrimental for this disease, both the mother and the baby are at increased risk for cardiometabolic, which means increased risk for cardiovascular diseases and obesity, as well as salt-sensitive hypertension later in life. So pregnancy itself is not typically characterized by a salt-sensitive hypertension phenotype. However, post-pregnancy, if a woman has a history of an adverse outcome such as a hypertensive pregnancy or a high blood pressure of pregnancy, those women are at very high risk for developing salt-sensitive hypertension later on in life. So it's very important for us to not only understand what causes the hypertension in pregnancy to treat those women to try to prevent the salt-sensitive hypertension, but to also try to understand what causes their salt-sensitive hypertension later on in life so that we can rescue those women from having high blood pressure and increased risk later on.
So how do these factors put women and their fetuses at risk both during pregnancy and afterward?
So having high blood pressure of pregnancy, which there are several different conditions that this is termed. So preeclampsia is a very famous condition that is a hypertensive pregnancy. You can also be diagnosed with chronic hypertension of pregnancy, which is a woman who has high blood pressure prior to pregnancy that keeps on during the pregnancy. Gestational hypertension, which is a new onset or pregnancy-induced high blood pressure, and superimposed preeclampsia, where a patient has high blood pressure prior to the pregnancy and then goes on to develop preeclampsia. So I use preeclampsia, and that's kind of a big word. Preeclampsia means a high blood pressure of pregnancy that is also accompanied by a list of symptoms that can include headaches, seizures, peripheral edema, which means swelling of the hands and feet, vision disturbances, as well as some other elevations in liver enzymes and other things that can happen in pregnancy. These women are at very, very high risk for having an early term delivery, for having a hemorrhage, and for having a small for gestational age baby, which means a baby that is very low on the growth curve. This leads to an increased risk for them to have hypertension later on in life and other adverse outcomes, including stays in a neonatal intensive care unit. So it's very important for us to monitor these patients that are developing hypertension in pregnancy or that have hypertension prior to pregnancy to make sure that we can manage their risk for these adverse outcomes.
So on top of that, what's happening at menopause that raises women's risk of hypertension and make them more likely to be salt sensitive?
So menopause is a change in a woman's life when she stops having her menstrual cycles or periods. And menopause is technically diagnosed when a woman has not had a period for 12 consecutive months. And what this really means is that that woman is no longer producing certain hormones, estradiol or estrogen and progesterone. So after the menopause transition, the production of these hormones goes way, way down. And we see that coincide with an increased risk of high blood pressure. The detriment of menopause to blood pressure risk is that these hormones are very vasoprotective, or they help the blood vessels to prevent high blood pressure. And we are trying to understand how these hormones actually lead to a protection from high blood pressure and whether we can supplement these hormones or not to be able to prevent that high risk. And that is ongoing research right now.
Well, can you explain how that's tested and why it's difficult for someone's healthcare team to do?
So it's a very important point, and whether a person is salt sensitive is not traditionally measured in a routine clinical visit. So right now, in order to determine if a person has salt sensitive high blood pressure, a certain amount of salt is given and then blood pressure is monitored. So if a person eats a large amount of salt and their blood pressure goes up, or they eat very little salt and their blood pressure goes down, that person is then termed to have a salt sensitive high blood pressure. That means that the reduction in salt in the diet is most likely going to be able to help that person keep their blood pressure low. And it's estimated that up to 50% of people with high blood pressure actually have salt-sensitive high blood pressure. So it's really a good idea for all of us to kind of reduce the amount of sodium that we eat and prevent the likelihood that we might develop high blood pressure in response to dietary salt.
What should women do in terms of monitoring their blood pressure throughout their lives? And what should they know about their sodium intake, especially if they have high blood pressure?
Women really need to make sure that they are aware of their risks. Make sure that you are going to the physician regularly, that you are getting your blood pressure checked regularly. We are at greater risk than we are sometimes told, and we are less likely to see the doctor when we think that something like stress is causing our high blood pressure. In particular, this applies to pregnant women. Pregnant women need to make sure that they are going to their prenatal visits, that you are getting your blood pressure checked regularly, and that you check your blood pressure regularly after your pregnancy, because pregnancy can lead to postpartum high blood pressure increases that are equally detrimental to those that are found in pregnancy. So it's very important for women to take control of your health care, make sure that you are being heard, and make sure that you are aware that if you have high blood pressure, you can make interventions to try to fix it. You can reduce the salt in your diet, you can exercise, you can have other lifestyle interventions, and you also are entitled to treatment with therapies. You don't have to live with it.
This has been very enlightening. Dr. Faulkner, thank you so much for talking with us about high blood pressure in women, and thank you for being with us on House Calls.
Thank you so much for having me. I enjoyed the visit.
Let's recap some key takeaways. Salt sensitivity, which increases blood pressure, affects many people, especially women. Hormonal changes after menopause make women more prone to salt-induced high blood pressure. Women have lower blood pressure than men in early adulthood, but their risk rises after menopause, making them more likely to develop salt-sensitive hypertension. Hypertension during pregnancy, like preeclampsia, raises long-term risks for both mother and child, increasing the likelihood of hypertension and cardiovascular disease. Women at risk should regularly monitor blood pressure and adopt lifestyle changes like reducing salt intake, engaging in regular physical activity, and seeking medical care to manage hypertension. If you have questions about health conditions, I'd love to hear from you. Comment below, hit subscribe, join me here next time for answers you can trust.